What are the major problems with eating animal products?
This is an area that had new data come out in just the last 6 weeks. We have known since about 2012 from the Cleveland Clinic that when you eat animal products, you can get a substance in your bloodstream called TMAO, trimethylamine N oxide. And before that, we were really focused on saturated fat, the fact that a lot of the meat would be fried or charred, and all of which have negative health effects. The fact that it increases serum cholesterol, all those were the concerns that we had about eating animal products. But then the Cleveland Clinic pointed out that as you eat the components of animal protein, and you're eating, that includes, for people who want to list the chemicals, betaine, creatine, phosphatidylcholine, and choline. Each of those contributes to the pathway for development of TMAO, trimethylamine N oxide, but the conversion actually happens in the GI tract. And so the Cleveland folks were trying to get us to pay a bit more attention to the bacteria in our gut. Well, years later now, we have so much more data on the microbiota, as it's called, the microbiome. That is, the microbes that are inside your gut control so many health effects that we were not aware of before. It turns out that they're associated with some major diseases, such as Parkinson's disease, if you have the wrong bacteria in your GI tract. And they actually do produce the inflammation that is associated with eating animal products. And the most interesting data from just a few weeks ago is that the severity of COVID illness is also related to how much of the bad bacteria you have that cause inflammation and cytokine storm. All of that is inside your GI tract. Most people don't realize that if you check the DNA of a human, it's not 100% human DNA. Actually, only about 46% apparently is actually human. The rest are all these microbes. And some of them are fungi and some are viruses, but it's mostly bacteria in the GI tract, and they control your health. So it's sort of a shocking area. We've been working on sort of the effect of it for decades, and we weren't really dealing much with the cause. And so a couple of things that we should say about the microbiota is that the GI tract bacteria are controlled by what we eat. And vegans have a very low amount of the bad bacteria, and meat eaters have a high amount of the bad bacteria. So if you could take a person who eats animal products, give them a steak and measure their TMAO level, it goes up. Measure their inflammation, it goes up. Cholesterol, sure. If you give that same steak to a vegan, they don't have the bacteria, at least not for the first few days. They don't have the bacteria that's going to have all the negative effects. So they don't get that TMAO rise, for example. Now, why is that important now? Because the issue of COVID and dying of COVID, we don't see a lot of, and I would love to, if anyone has a bunch of cases of vegans dying of COVID, I would love to see it. I have only a few hundred that I know, and they have gotten COVID and not developed a serious illness. I don't know of actually any who were actually admitted to the hospital, certainly not ventilated or died. And it has to do with the microbiome, according to the publication from a few weeks ago. So plant-based nutrition, it was timely before, but it's even more timely now. And so I'm trying to tell everyone, go vegan for COVID, hashtag, but I'm hoping that people will hear that message that they need to, lose the weight, lower the cholesterol, lower the blood pressure, lower the blood sugar to avoid a bad outcome from COVID. And eating animal products is sending you in the wrong direction, not just because of its effect on those four things, but because of the microbiome that's responsible for the inflammatory response that destroys your health when you have COVID.
Taking that a step further, can you expand more on how to prevent a bad case of COVID? Does your weight, your blood pressure, cholesterol level, or blood sugar level make a difference?
interestingly, we've been really hit hard, particularly in people of color. And a lot of that has to do with the, what people are calling structural racism. That is, if you, have a inheritance from, a previous generation that did well economically, and you have support to go to school, then you are actually going to do well. If you're in a community that doesn't have that to the same degree, they're not going to do as well. Okay, so how does that relate? Well, it turns out that the people of color in this country who have not had the economic advantages will have lower paying jobs. They have jobs where they have to show up to the chicken factory or risk losing their job, and then end up with a bunch of COVID cases and some even dying. And so that, when people say structural racism, we're not even talking about people's attitudes today. We're talking about how the communities are built and the population size and the number of people who are close together, and whether people can socially isolate, and do they actually have to go to work and face people who are going to, be abusive when you ask them on a bus and you're the bus driver to actually wear their mask. And so all of this becomes highlighted during the COVID era. And on top of that, we have people who have more cardiovascular disease and higher degrees of obesity. And so every study that's looked at it will tell you that being Black increases your mortality rate, but it's not because you're Black. It's not your race, it's your risk. And so if you adjust the model for all of the risk factors, you find out that every study shows about the same thing. At Rush, it was 21%. In New Orleans, it was 11%. There's a slight protection of being Black. So why are so many people dying? It's because of the risk factors. And so the best way to avoid a bad case of COVID is to start now, because we're not done with this pandemic. We need to decrease the weight, decrease the blood pressure, get the cholesterol down, and the blood sugar down. The way to do that is plant-based nutrition and exercise on a daily basis. I'm still leaving a lot of room for vaccination. People really argue a lot about vaccination because it's relatively unknown. We're walking into an area that we haven't seen before. And did it give me a little pause to get a messenger RNA vaccine? Maybe for a half a second, until I realized the bigger picture. It's my job, particularly as a vegan, to do everything I can to not get this illness. Why? It's not just for me, but it's so that I don't transmit it to everyone else. And with the microbiome of a vegan, the odds of me getting a serious case of COVID is fairly low. And there's a good possibility that I could have asymptomatic COVID because I'm a vegan and otherwise healthy. And if I'm spreading it around, not unwittingly, that isn't good for everyone else. So definitely you might find out that the vaccine has some real problem in 10 or 20 or 30 years. But I'm doing it right now to save my fellow people because we're in the middle of a pandemic. And so I would say that get the weight down, monitor the blood pressure, make sure get it to normal, cholesterol level, blood sugar, and vaccination. Those are the ways to prevent a bad case of COVID.